Katina.
Okay. You both previously voiced your thoughts on expanding Medicaid. Mr. Lee, you said you opposed it. Mr. Dean, you support it. However, the current legislature has opposed even a compromise with Governor Haslam. Simply put, Medicaid expansion is not going to happen with this legislature. And this impacts hundreds of thousands of low-income Tennesseans. And I want you to take a listen to one of the people that's actually struggling with these consequences.
I told the young lady that answered the telephone that I was a terminal cancer patient, a veteran who relied on Medicaid, and that if this bill was passed, I would lose what little access I had to health care and that it would hasten my death.
So, what would you say to people like Kelly Gregory and the tens of thousands of people in her shoes? Mr. Dean, we're going to begin with you.
Well, I've actually talked with Kelly on several times, and I believe she is a supporter of mine in this race. And what I would tell her is this, that we need to expand Medicaid. And it comes down to this. It not only is the right thing to do in terms of people like Kelly who need access to insurance, and we're talking about people who are veterans. We are, for the most part, talking about working people who can't get insurance. And we want these folks to be able to have health care. And so right now we have, over the past few years, lost over $4 billion that could have been used to help them because we turned down Medicaid expansion. We turned down a proposal that Governor Bill Haslam worked hard on that would have protected our state, that would have been better than most states have gotten, and the legislature said no. But the most telling thing is that our legislature has no plan B. I mean, there was a good plan A there that was presented that was a very rational thing for us to do. But there's been lots of criticisms, lots of attacks on past presidents or on past issues, but no plan for the future. We need to act, and we need to expand Medicaid.
Okay, Mr. Lee, I'm going to get to you in just a minute, but Mr. Dean, I want to talk to you about that, because if the legislature has defeated this twice, what will you do now? People are hurting and they are sick now. So what can you tell the people that you will do now?
No, that is the best point anybody can make. People are hurting right now. So to talk about putting this off for 15 and 20 years to study it is the wrong approach. You know, this is self-serving, but it's the truth. If you want Medicaid expansion, you vote for Carl Dean for governor. You say that we're going to have a governor who has worked.
Okay, audience. Okay, we want to give our candidates more time to answer the question, so please hold your applause.
You say
Mr. Dean, the question is, I'm sorry for interrupting, the question is, though, is what will you do right now?
That's what I'm saying. You elect a governor who has campaigned on this issue and has said this is a priority for the state. The polls, Vanderbilt and all the other organizations, show well over 60% of the people in Tennessee support it. The legislature is going to be different. But I think what I would have to do is work with the legislature and say, let's compromise, let's work together, let's find solutions. We're elected not to stand on party partisanship. We're elected to get things done for the people of Tennessee. We need to save rural medicine. We need to save rural medicine. We need to make sure that the 300,000 people are getting coverage, and we got to stop throwing away money.
Thank you so much. Mr. Lee, I am coming to you. But, Mr. Dean, you haven't answered my question quite yet. You just said that you should be elected. Once you are elected, what will you do? Because these people are hurting now.
The first thing I would do is meet with the legislature and say, let's work together, let's compromise, let's find solutions. The voters have just spoke. Now, let's see if we can come to an agreement about how we expand Medicaid and under what grounds, and how we can protect the state of Tennessee fiscally and financially, and how we can make sure we're helping people right now.
Mr. Dean, thank you so much. Okay, Mr. Lee, I'm going to ask you the same thing. First, we're going to go back to Mrs. Kelly Gregory. So, after you've heard what she said, what would you tell her?
I would tell her that every Tennessean deserves to have access to health care that they can afford. And as governor, I'm going to work to develop a plan so every Tennessean has access to quality health care that they can afford. The reason that so many people can't access health care in this country and in this state is because they can't afford it, because we have a fundamentally broken and flawed system that does nothing to address the rapidly rising cost of health care that far surpasses the inflation rate. In my own business, our health care rates went up 29% 2 years ago. And then on top of that, last year they went up 19%. That is an example of an unsustainable rise in cost that will ultimately make health care affordable to everyone. We have a broken system. Making that broken system even bigger, expanding it even beyond where it is today, is not the right approach for Tennessee.
Okay, Mr. Lee, so I have a question for you. If you're a follow-up at least, if you're not going to expand Medicaid, then how do you help those who are uninsured?
You develop a system that has incentives to lower the cost. Think about this in TennCare. You have a TennCare patient who has a sick child. They can take their child to a primary care physician, or they can go to the ER, significantly higher cost. There is no incentive for that person to take their kid to a primary care physician. We have a system that does nothing to reduce the cost of health care, and there are clear steps that we could do starting today that would begin to reduce those costs in Tennessee. And that's what we ought to do. We ought to fix a broken system, not expand a broken system.
All right, Mr. Lee, thank you. Bob, we're going to have to move on to you.